I'm Philip Ward, Editor-in-Chief of AuntMinnieEurope.com, and I'm here at the European Congress of Radiology with Dr. Emanuele Neri, who's President of the European Society of Medical Imaging Informatics, or formerly EuroPACS. Dr. Neri, I wonder if you could start by explaining why there was a need for the rebranding. Why was EuSoMII created?
Yes, EuSoMII is a rise from, as you mentioned before, from the EuroPACS Society. The EuroPACS Society is a society with a long history. It was founded in 1984 by a group of scientists, of experts in picture archiving communication system. But as we know, picture archiving communication systems have evolved because at the beginning there were experiments, just in an experimental phase, and nowadays they are not anymore small things but are big systems. We can call them like intelligent infrastructures of our daily work. So the name PACS was really restricted for the field of interest of the society. So we decided, after an internal discussion, a big discussion among the board members, but not only, involving the members of the society, which name they would prefer, and if they would also prefer to change the mission statement of the society. And this has been changed, of course, in the European Society of Medical Imaging Informatics to widen the scope of the society to cover all the aspects of information technology in radiology, but I would say in medical imaging and in medical therapies.
Excellent. So perhaps you could explain what's been done so far, how you've progressed, because I think it was October that you changed the name, that you went over to EuSoMII. How has it developed since then?
So the name was officially changed during the CARS conference in Heidelberg last year during the General Assembly. But the big step, I think, also was the admission of the society as an institutional member of the European Society of Radiology.
Excellent. So you're fully involved now, you're fully signed up in ECR, is that?
Yes.
As an affiliate member?
Yes, the society actually is officially an institutional member of the European Society.
Okay. So you've been involved with the program this week, with the drafting of the sessions and topics?
The EuroPACS Society has been always involved in the drafting of the program of the European Congress of Radiology and is taking care since year of the computer application track. This year, as EuSoMII, we proposed to the president of the conference, Valentin Senixin, to organize a new element which is called multimedia classroom. The multimedia classroom is here as the first floor of the conference, and is a big room with different workstations from different companies where radiologists can be trained to review and process with very high performance workstations from different vendors. We can review different cases from CT colonography, for cardiac CT, trauma cases, and oncology.
Excellent, good. So people can sign up if they see this video and they want to sign up for the multimedia classroom. You still have places?
Yes, absolutely. I would like to invite attendees of the conference to go downstairs in the first floor, in the registration area. There is a dedicated booth for registration to the multimedia classes. So please register, because this will be a new event where there will be a real doctor-to-doctor training. Because during the sessions, you will be invited to review cases on the workstation, and you will be assisted by doctors.
And there's no extra charge for delegates. No. They can come and they're free. In terms of medical imaging informatics in Europe, what would you regard as the hot topics? If for example, there were three hot topics, is it tablet use, on how that's used in clinical practice? What would you regard as the main issues?
I think that there are two hot topics. I think certainly the use of tablets is one of them, because there will be here at the conference today a refresher course on the use of tablet, where we will discuss the suitability of tablets for clinical use. If they are, reliable, if they are safe, if you can read images, and so on. And most of these topics will be discussed by the speakers. The other topic I think that is strongly related to this is teleradiology. Teleradiology is still a hot topic, despite it's not a new topic, but it's still very hot. I give you the example of Italy, my country. In my country, teleradiology is arising a lot of issue of management from the point of view of the professional of the radiology, from the point of view of the patient care. So it's really, really hot. And it's not the case that the European Society of Radiology is working to produce white papers on that.
Good. So lots to talk about this week, but also you're from Pisa in Italy. Do you have any viewers maybe planning their holidays at the moment, their vacation? Is there any suggestions, anywhere they should visit in Pisa at the moment?
Yes, of course. In Pisa you can visit the Miracle Square, where there is a leaning tower that is still leaning, of course. And that's the main attraction. That Pisa has a lot of attraction. If you want, I can suggest a good restaurant, meat restaurant, which is called Bruno. It's a really, like being at home, like being invited by an Italian at home. Really good food. And so for this, they have to thank me for this advertising.
Excellent. Good. Okay, so everyone will be booking their place now. They'll be looking up on TripAdvisor.
I'm
for
sure.
Bruno's restaurant in Pisa.
Bruno.
And you might meet Dr. Neri there if you book your table.
Yeah.
Thank you very much, Emanuele, and I wish you every success this week.
Thank you, Philip. Okay.